If you're here, it means you want to learn how to do light lymphatic massage for plugged ducts and mastitis. Before, you might have been told to massage it out and really work and dig in it to try to get the plugged duct out. Now we know that only makes it worse, and we are actually treating inflammation, which requires a lighter approach to encourage the excess fluid back into the system. My name is Annie Abbasi. I am an occupational therapist and lactation consultant, and today I'm going to show you the light lymphatic massage technique, what it is, why it works, and how to do it safely. So if you haven't watched my previous video about what plugged ducts and mastitis are and the updated recommendations are for that, I encourage you to go back and watch that as well so you know exactly what we're trying to address. Just very briefly, what we know now is that a plugged duct and mastitis is more of a spectrum, and there's no actual clog or plug in there. It is all swelling. So we are addressing swelling and not a plug. This changes everything as far as what the old recommendations were and what the updated guidelines are. So why lymphatic massage works for this is because the lymphatic system is a system to get rid of excess fluid or swelling in the body. Your lymph vessels are sitting superficially in your body, and there is a lot of lymph nodes in the armpit area and then also in the neck and back of the neck area. So for the breasts specifically, those are the lymph nodes that we're going to be focusing on. So when you're doing this massage, if you're feeling your muscles, you're already too deep, because you do not need to go that deep because your lymph vessels are closer to the surface. And also we want to be gentle with them. So I want to make sure that I emphasize that this is supportive care along with all the other recommendations. This alone is not going to do much as far as prevention or cure, but it will certainly aid with the rest of the interventions. So how do we do this massage, and what are the techniques? It's much like petting a cat or applying lotion. That's as deep and that's as hard as it needs to be. We're going to use an open hand and flat fingers. No knuckles, no fists, no elbows are needed for this. So the timing for this is best done either before or after feedings, and it doesn't need to be done obsessively, just a few times a day. Okay, so for this technique, we are going to activate those areas of bunched lymph nodes first. So we'll take our flat hand and go behind our neck area and just do 5 light circles like this on your skin. And it's just a light stretch of your skin, nothing more than that. In the back here, 4, 5, and then also like kind of in the triangle area with your collarbone. We're going to do 5 there. 1, 2, 3, 4, 5. And then finally in the armpit of the affected breast. And then it's just kind of cupping your armpit, again, flat palm. And we're just going to go 1, 2, 3, 4, 5. Direction of these circles don't really matter. We're just activating those lymph nodes. Now, with the massage itself on the breast, we are working from the top back to the body, because we are encouraging that fluid to go back into the lymphatic system and recirculate in our body to be filtered out. And it's best if you can have your hand directly on the skin. I'm just wearing a sweatshirt because no one needs to see that, but you'll get the idea. So once we're done activating the lymph nodes, we can start on the breast tissue itself. And we'll start close to the lymph nodes and just encourage fluid back gently. And then on the breast tissue itself, we'll start closer to the nipple and pull back towards the body. So really, as long as you have the pressure correct and you have the direction correct, you really can't go wrong with this, with the correct pressure and direction. So we're working from the nipple back to the body because we are encouraging that excess fluid in the breast causing that pain and swelling to go back to the lymphatic system that occurs here in the armpit, and then here kind of in the collarbone area, and then in the neck area. So we'll encourage that fluid up and back. No more than petting a cat. This should not hurt. Very light. This is as opposed to the old recommendation to where maybe there was a swollen tender area here and you'd want to dig. Now we know that probably only made things worse, so we don't want to do that anymore. Light massage. So really, this only should take 1 to 3 minutes total It should not take you any longer than that. And again, you can do it a few times a day, but you don't need to obsess over it. So this light massage should provide relief. It should be calming. It should be very subtle. No more than 3 minutes. No stronger than petting a cat or applying a lotion. Skin to skin is going to be the best type of method. What it should not feel like is it should not be painful. It should not cause more tenderness. It should not cause more swelling. You should not bruise from it, and you're not breaking anything up. It's not a knot. It's not a plug. It's inflammation. We are just encouraging that fluid back. When you are causing more pain, that's only going to cause more inflammation to that area. So we're going to pair this again as supportive care when we're going to pair it with all the other methods, ice, rest, hydration, and then use of NSAIDs as directed by your provider. If your symptoms are not improving over the next 24 to 48 hours, that would be a sign to reach out for extra help with your provider or with a IBCLC for further assessment and address however you might need. If you're having reoccurring plugged ducts or mastitis, it's important to reach out to a lactation consultant because there might be an underlying reason why that is occurring, and they can help problem solve and assess through that to see what's going on. If you haven't watched my video before about what plugged ducts and mastitis actually is and what the updated guidelines are, please go watch that as well so you have a better understanding of what we're doing here. Thanks for joining me, and I'll see you next time.